Hello to all of the audiences. We are from SGD number B1. We'd like to present our student project entitled Tetanus. But before moving forward to the next presentation, let me introduce to you the member of SGD number B1 as shown in the slides. For the next speakers, the time is yours.
Name is Ariel Arnas with the last digit number of student ID is 002. I will explain about the background of the student project. Tetanus, a severe bacterial infection, is caused by contact with Clostridium tetani spores found in soil, saliva, dust, and feces, causing lockjaw and painful muscle contractions. 13,502 cases worldwide. More common in low-income societies, especially in developing countries. Anamnesis is an important element in identifying and diagnosing. Proper treatment can prevent disrupt function, reduce mobility, interfere with day-to-day activities, and result in irreparable disabilities. The problem formation is: what is tetanus? What is the initial cause of tetanus? How does tetanus occur? What factor can increase the likelihood of getting tetanus? How to make a diagnosis of tetanus? What are the differential diagnoses of tetanus? And how to treat tetanus? And there are two objectives. The first one is general objectives, is to explain about tetanus, how to make a diagnosis of tetanus, and how to provide treatment for tetanus patients. And the second one is specific objectives. The first one is explain about tetanus, explain the initial cause of tetanus, explain how does tetanus occur, mention factor can increase the likelihood of tetanus, explain how to make a diagnosis of tetanus, describe the differential diagnosis of tetanus, to provide treatment for tetanus patients. There are two benefits of this student project. The first is the author are expected to add insight into tetanus and how to treat tetanus correctly, including how to make a diagnosis of tetanus and how to provide treatment for tetanus patients. The second, for the other authors, it is hoped that this can be a reference for further studies regarding more in-depth matter regarding tetanus. That's all from me. Thank you.
Thank you. My name is Igede Pramaditya Wahyu Saputra, and the last three digits of my student numbers are 045. In this occasion, I would like to present the definitions of tetanus. Tetanus is an infection caused by a bacterium called Clostridium tetani. Tetanus is characterized by muscle spasms starting from the face and then spread to the rest of the body, lasting from minutes to weeks. These symptoms will lead to dangerous complications such as aspiration. Hence, tetanus itself doesn't need a laboratory test to confirm the diagnosis, but it's better for the clinician to treat the symptom itself first. The symptoms are caused by the toxin that this bacterium produces and affect people with weak immune systems, mainly the ones that have not got vaccinated. That's all from me. The next presentation will be continued by my friend. Thank you.
Okay, thank you for the time. My name is Judah, and I will explain the etiology of tetanus. Tetanus, a medical condition caused by the pathogenic bacterium named Clostridium tetani, is characterized by its association with the genus Clostridium, which comprise obligate anaerobic saprophytic gram-positive microorganism. Clostridium tetani is a bacterium that can be detected in various environmental sources such as a soil, a dust, and animal feces. The eradication of the spores of the environment is unattainable. Clostridium tetani has the potential to gain access to the human body via various means including wound puncture, laceration, skin breaks, or through the inoculation of an infected strains or insect bite. The risk factors associated with the neonatal or neonatal tetanus encompassed by several key elements, including maternal non-vaccination, delivery taking place within the home setting, and the utilization of unsterile instrument during the umbilical cord cutting procedure. Okay, that's all from me. For the next speakers, the time is yours.
Hello everyone, my name is Asikirana with serial student number 087, and now I would like to explain about the pathophysiology of tetanus. Tetanus typically initiates when spore from Clostridium tetani, commonly present in the ground, enter the body through an open wound. An aerobic condition in the wound over an ideal setting for the spore germination, where Clostridium spore transition into active vegetative forms. Then, the bacteria produce a potent neurotoxin called tetanus plasmin, which spread throughout the bloodstream and lymphatic system, and tetanus toxin, which is capable of harming living tissue at the wound site and creating an advantageous environment for bacterial proliferation. Tetanus plasmin is transported via retrograde axonal transport to reach the central nervous system. Upon the entry of this toxin into the presynaptic terminal situated at the neuromuscular endplate of the motor neuron, it cleaves the vesicle-associated membrane protein, causing a disruption in nerve transmission. This disruption affects the release of inhibitory neurotransmitter like gamma aminobutyric acid and glycine, which typically serve to restrain motor neuron activity. As the inhibitory signal is blocked, there is a continuous and unregulated stimulation of the muscle, resulting in muscle stiffness or spasm. That's all from me. Thank you.
Okay, so my name is Fairza Husniadiba with real last digit of student number 102. So I'm gonna add a little bit more explanations about the pathophysiology of tetanus just to make it more clear. So as my teammate said in the previous slide, to cause the convulsive spasm and muscle rigidity, the Clostridium tetani has an important agent called tetanus plasmin. So this neurotoxin act in the motor end plate of central nervous system, and they block the GABA and glycine, which is the neuroinhibitory that used to inhibit our motor reflex, and by that there gonna be disruptions in our motoric functions, resulting in spasm. So any sites of the blocking, there gonna be spasm in there. So if they block in the masseter area, then there gonna be spasm in our mastication muscles, making us difficult to open our mouth, and that can be called as lockjaw or trismus. And spasm in the back muscles, that can be called as opisthetonus, and spasm in the facial muscles, that called as rhizus sardonicus. So I guess that's all from me. Thank you. Next.
Hello, I'm Mario with student number 123, and I'm here to talk about the risk factor of tetanus. There are two main groups that are very high risk of getting tetanus. The first one, in most developing countries, are unsterilized birth. That there are many cases of tetanus getting into babies because of unsterilized birth, like the equipment is not sterilized enough to not getting tetanus. And the second one is the most generalized one, is unvaccinated people like kids, babies, or elderly, or even adults that are not vaccinated enough to prevent the tetanus. That's all I gotta say. Thank you.
Hello everyone, my name is Nadia with my last 3D number 160, and I will explain about the diagnosis and tetanus. So tetanus should be concerned when patients show some certain signs and symptoms such as having an exposure to cuts, scrapes, puncture, and trauma, and other signs include stiffness of muscle, especially lockjaw, and their involuntary muscle spasms, seizures, headache, fever, and sweating. And it is also said that tetanus had no particular test to confirm this disease, but there is still tests that might help healthcare to diagnose tetanus, which is a spatula test. So spatula test involves stimulating the posterior pharyngeal wall, allowing the masseter muscle to contract atomically and cause the patient to bite down rather than gag. Other tests that could be done to diagnose tetanus is the antitoxin level assay. Thank you, and the next will be presented by my friend.
I am Gustiagung Krisania Putri with the last 3 digits of my student number are 143. So aside from being clinically diagnosed, tetanus may be diagnosed by isolating the organism that is found in positive wound culture. By inoculating and gram-staining Clostridium tetani from a site of infection, the structure of gram-positive anaerobic bacilli can be observed. Furthermore, the presence of the TETx gene that produces neurotoxin can be detected by amplification with PCR, and later that pure neurotoxins from isolate will be injected into mice. The symptoms that happen to the mice will determine whether the clinical isolate is Clostridium tetani that capable to produce neurotoxin or not. However, tetani is not conveniently culturable. Moreover, only highly developed laboratories can conduct PCR-based assays to diagnose tetanus. Real-time recombinase polymerase amplification assay, or XORPA, can be an alternative to RT-PCR. The XORPA can identify neurotoxin gene from fragments of Clostridium tetani with a detection limit of 20 copies per reaction, and the results come out in less than 20 minutes. That's all from me. Thank you.
Hello, my name is Nyoman Gede Wiragunadra Paramarta and my last three-digit number is 180, and I'm going to explain about the differential diagnosis of tetanus. In the case of tetanus, differential diagnosis includes consideration of many other medical conditions that can present with similar symptoms. The first one is muscle disorders. Muscle disorders that can be a differential diagnosis of tetanus are muscle strains or sprains, which cause muscle pain and stiffness due to sudden stress, while tetanus causes muscle stiffness and spasm, and sprains which cause local pain in the affected area. The second one is spinal cord injuries. The main differences being in the onset, nature of the muscle symptoms are associated neurological deficits. Tetanus usually appears gradually and is characterized by muscle stiffness and painful spasm, while spinal cord injuries result from acute trauma and can lead to muscle weakness, paralysis, and decreased sensation in specific areas of the body corresponding to the extent and severity of the injury. And the last one are neurological disorders. A neurological abnormalities that must be considered in the differential diagnosis of tetanus are Guillain-Barré syndrome or GBS. GBS is an autoimmune disease that affects the peripheral nervous system. It typically presents with progressive muscle weakness, tingling, and numbness rather than muscle stiffness and spasm. GBS is rarely associated with severe muscle spasms as in tetanus. So that's all from me. Thank you.
Hello, my name is Janerka Pramesti with the last three digits of the number 208. So now I'm going to tell about the treatment and management for tetanus. Human tetanus immunoglobulin, or HTIG, is the first-line treatment to eliminate the release of tetanus plasmin toxin. 3,000 until 6,000 units is the therapeutic dose in the case of generalized tetanus. Diazepam is the most frequently used in tetanus, not only as a muscle relaxation, but also to minimizing potentially fatal respiratory issues. Tetanus can be prevented by immunization with tetanus toxoid-containing vaccines or TTCV. DT or diphtheria and tetanus vaccines, DTaP or diphtheria, tetanus, and pertussis vaccines, vaccines against tetanus and diphtheria or TD, vaccines against tetanus, diphtheria, and pertussis or TGAP. Babies and children under the age of 7 are given DTaP or DT, while older children and adults are given TDAP and TD. WHO recommended an individual receive 6 doses of TTCV, 3 primary plus 3 booster doses to be protected for life. 3 doses primary series should begin as early as 6 weeks of age, with the following doses spaced at least 4 weeks apart. Ideally, the 3 booster doses should be administered during the second year of life, 12 until 23 months, and at the ages of 4 until 7 years, and at the ages of 9 until 15 years. Ideally, at least 4 years should elapse between booster dosages. Neonatal tetanus can be avoided by immunizing women or of reproductive age with TTCV before or after pregnancy. Furthermore, strong medical practices such as clean delivery, cord care during labor, and adequate wound care for surgical and dental treatments can help prevent tetanus illness. That's all from me, and will be continued by my partner. Thank you.
Hello, my name is Kamala Sri Bungasdani with the last 3 digit of student number is 241. I will explain about the treatment and management of tetanus. In patients with suspected tetanus with no symptom, the severity of the wound, vaccination history, and other medical history of the patient should be assessed. To prevent bacterial development, the wound should be cleaned thoroughly, surgical debridement of the wound and also surrounding tissue should be arranged. Then the patient is given intramuscular tetanus immunoglobulin if needed. In treating tetanus patient, especially severe tetanus, supportive therapy is necessary to prevent the condition from falling into intensive therapy. If muscle rigidity and spasm, the respiratory tract is a vital concern. It's important to ensure the patient is adequately ventilated to prevent respiratory failure. Tracheostomy and mechanical ventilation are necessary, especially in patients who are receiving high dose of sedatives to control their muscle rigidity, and spasm. Nutrition status in tetanus patient also need attention. The presence of dysphagia, digestive system problems due to autonomic activity, and increased metabolism are the several factors in frequent weight loss, which, if not treated properly, can worsen the prognosis. If the patient's trismus persists, the nutrition is given parenterally. But if it has subsided, the nutrition's delivery can be done with enteral, starting through a nasogastric tube until it can be complete through the mouth. Tetanus patients also should be treated in the ICU. In addition to intense observation, a quiet and dark room is also needed to avoid sensory triggers for muscle spasm.
Hello everyone, my name is Rafadiar Dravajri. With my last three digits of my student number is 244. Okay, so the conclusion. Tetanus is a medical condition caused by the bacterium Clostridium tetani. It's characterized by muscle spasm that start in the face and can spread throughout the body, lasting from minutes to weeks. This bacterium can be found in soil, dust, and animal feces, and can enter the human body through wound, breaks in the skin, or contaminated syringe, or insect bites. In wound, it can thrive due to lack of oxygen, producing toxin like tetanus plasmin and tetanolysin. Tetanus can affect people of all age, often due to inadequate wound care and lack of vaccination awareness. Symptoms include muscle stiffness, lockjaw, spasm, seizure, headache, fever, and sweating. It can be mistaken for other muscle or neurological disorder. Treatment involves human tetanus immunoglobulin, and prevention is possible through tetanus toxoid containing vaccine. Maybe that's all from me. Thank you.
Okay, that's all for our student project presentation. We would like to apologize if there are any mistakes in our student project presentation. Thank you for your attention and thank you for watching our student project presentation.